On this episode, we'll talk about taking Viagra after weight loss surgery. We'll also be talking about taking Ozempic or Wegovy after weight loss surgery for regain. And we'll talk about having a fatty liver disease and being eligible for weight loss surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 218 of the AskDrA show. Thanks so much for joining us. And if you're new to the show, you want to send me your questions, you're more than welcome to do so using the hashtag AskDrA throughout social media. That way we're able to grab those questions, add them here to the list, and I'll be here more than happy to answer them for you. And also, if you're interested in weight loss surgery, gastric sleeve content, be sure to subscribe to our channel. That way you don't miss out on any of our future videos. Let's get into the questions for this week. So let's talk about taking Viagra or any similar drug or medication after weight loss surgery. Can you take it? The answer is yes. It does not have anything to do with your surgery itself. It will not get absorbed differently. It will not be metabolized differently, and it will not interact with your weight loss surgery differently. So if you are used to taking these medications, you can continue taking them afterwards. It will not affect the surgery, or it will not affect the absorption or the metabolism of your medication per se. So it will not interfere whatsoever. Now let's take a closer look on Ozempic, Wegovy, or those are brand names for semaglutide. And we talked about this before. We actually have a video on this specifically. We'll link it down below in case you're interested in learning more about these medications, GLP-1 agonists. So these medications, the specific question is, can you take Ozempic or Wegovy or semaglutide for weight regain? The answer is yes. It is a very good ally toward weight loss surgery. If you've had weight loss surgery in the past, 2 years ago, 3 years ago, 5 years ago, 10 years ago, you had some weight regain. Can you take this medication? Yes, under medical supervision. Talk to your doctor if you are eligible for this medication. We've talked about the price on this medication. It's very expensive at this point. As of this recording, 2023, it is an expensive medication. It's a medication you simply cannot stop taking because here comes the weight back on. So you need to make sure, number one, you can afford it. Number two, is it for you? Can you take it? And do you have any contraindication to take it? Have you had any thyroid tumors in the past? You or your family history? Any pancreatitis? Any? Talk to your doctor, see if you're eligible. Now, yes, you're eligible. Can you afford it? Can you afford it for this month, for next month, for a year of paying $1,000 or $1,300 or more, depending on the area where you're buying this medication? Can you take it down the road? Because this medication, it's like a diabetes medication, it's like a high blood pressure medication. Simply just can't take it for a month or two and stop taking it. This is continuously, all right? So you need to make sure you can afford this medication. But back to the question, can you take it? Yes. Will it help? Yes, and it's very powerful ally with weight loss surgery. Now, let's talk about having a fatty liver disease. The question is, I have a fatty liver disease, can I get weight loss surgery? The answer is yes. We know that if you are eligible for weight loss surgery, vast majority of our patients, I want to say pretty much everyone, has a fatty liver disease. All right, that's a non-alcoholic fatty liver disease. This means that patient has a fatty liver, not because he or she is an alcoholic because they're drinking. It's called a non-alcoholic. It's because of the carbs. It's because of the diet. It's because the standard American diet. Because eating the standard American diet, you are prone to have in 2023, you're prone to have a fatty liver disease between a 10 and a 46%. 10 to 46, that's close to half. So 1 in 2 almost will have a fatty liver disease if you're eligible or not for weight loss surgery. So anybody that you grab that's walking the sidewalk, you grab them, 1 out of 2 pretty much will have a non-alcoholic fatty liver disease just because the way we eat. All right, so of course we're expecting a fatty liver disease on patients that are eligible for weight loss surgery because that's what they're getting surgery for. So that is the importance of listening to your doctor and the guidelines he or she gives you, and the pre-op diet. The pre-op diet will help shrink that liver to be able to have surgery that day, and then the surgery will help you get rid of the fatty liver disease in the vast majority of the cases. All right, so there you have it. That is it for episode 218. Wow, 218 of the Ask Dr. A show. Hey, send me your questions. If there's no questions, there's no show. I'll be more than happy to be here for you. Hey, don't forget to subscribe to our channel. And if you liked this week's questions, because they're really good questions, if you can leave me one of these, it's very helpful to the YouTube algorithm, and I appreciate your support to the channel. So I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.